Hey guys, Jeremiah here to discuss the secondary assessment with you. Specifically, what body systems you need to assess and what questions you should be asking. So, if you're looking at your patient assessment medical sheet, remember, secondary assessment comes after history taking. So, after you ask your OPQRST and sample questions, you're then going to jump into the secondary assessment. The purpose of it is to perform a detailed physical examination on your patient based on their chief complaint. I'm not sure if your instructors have told you or not, but the maximum amount of points you can receive here is 5. And in order to receive all 5 points, you need to assess 5 separate body systems as it relates to the chief complaint. Let's say your patient has a complaint of chest pain. The first body system you want to assess is cardiovascular. When you get here, I recommend you expose your patient and you look for things that would suggest they have a cardiac history. This includes pacemakers, nitroglycerin medication patches, maybe an LVAD device, which is a left ventricular assist device, or they might have scars that suggest they had cardiac related surgery. Another thing you can do is listen to the patient's heart. And what you're listening for is an arrhythmia. If you have a patient who's suffering from a myocardial infarction, it may put them into an arrhythmia, so you're going to listen for that. If you're familiar with heart sounds, you can go ahead and listen for normal heart sounds. Not every EMT is, so I don't expect you to do that. Next is the pulmonary system. Remember, the pulmonary system and the cardiovascular system are closely tied together, and when you have an issue with one system, it's going to affect the other. With the pulmonary system, you want to listen to lung sounds. Specifically, what you're listening for is adventitious lung sounds, or abnormal lung sounds. An example of an abnormal lung sound would be crackles or rails, which indicates fluid in the lungs. And one thing that can cause fluid in the lungs is congestive heart failure. So you may have a situation where your patient has chest pain because they're having an MI and it's now resulted in congestive heart failure. So we're going to listen for that. Remember, when you're listening to lung sounds, you want to make sure that you place the diaphragm of the stethoscope on the patient's bare skin and not over clothing. If you're listening to lung sounds anteriorly on the chest, you want to listen in the 6 fields. And when you listen, you always want to compare one side to the other. With the pulmonary system, you can also check the neck for distended neck veins, and you want to check the feet for pedal edema. Distended neck veins and pedal edema can indicate congestive heart failure, specifically right-sided congestive heart failure. We talked about pulmonary edema a minute ago. That usually is left-sided heart failure. So it's important to know the difference between the two, because if you know what you're looking for, then you can kind of suspect what's going on with the heart. Okay, so we covered cardiac and pulmonary. The next body system is neurological. There isn't a real hands-on physical assessment that needs to be done here. However, if you're looking for a point, what you can do is say that you would pay strict attention to the potential for altered mental status due to cardiac compromise. The next body system is musculoskeletal. When you get here, you want to ask the patient if they've had any trauma to the chest. Another thing you can do is palpate, press on the chest, and you want to know when you palpate or examine it if the pain changes at all. Another thing you can do is ask the patient to take their hands and raise them out in front of them, out to the sides, and then up above their head. What you're doing here is testing their mobility, their range of motion, and you want to know when they move, does the chest pain change at all? If the patient's pain changes when you press on it or when they move their arms up and above their head, then there's a possibility that it's not so much cardiac related, that it's more musculoskeletal. The next body system is integumentary, which pertains to the skin. So when you get here, you want to assess the patient's skin color, the skin temperature, and the skin condition. Remember, if a patient is pale, cool, and clammy, that indicates that they are in shock. The next and last body system I recommend you check is GIGU, which stands for gastrointestinal or genital urinary. When you get here, again, there really isn't a physical assessment you need to do. Instead, what I recommend is you ask if the patient has experienced any sudden, unexplained nausea or vomiting. One sign of a myocardial infarction can be nausea and vomiting, so we definitely want to ask about it. So a quick recap with cardiovascular: you want to expose your patient, look for indicators of a cardiac history, such as a pacemaker or a nitroglycerin patch. You can listen to the heart sounds. With respiratory, I want you to listen to the patient's lungs. Also look for distended neck veins or pedal edema. With the neurological system, just say you're going to pay attention for the potential for altered mental status. With musculoskeletal, I want you to palpate the chest, ask the patient to move their arms out to the sides and up above their head. Move on to the integumentary system, you're checking the skin color, temperature, and condition. And then GI/GU, I want you to ask about any nausea or vomiting. All right, so hopefully that clarifies the secondary assessment for you. If you found this video helpful, make sure you give it a thumbs up. Make sure you subscribe to the page. And as always, take care and be safe.